Okay, we're going to talk about rheumatoid arthritis-related neuropathy. I'm Dr. Martin Rutherford. I'm a certified functional medicine practitioner. I'm also a chiropractor for 35 years. This is Dr. Randall Gates.
Board-certified chiropractic neurologist, also a chiropractor.
Together, we have combined to run ultimately a alternative, better maybe integrated chronic pain practice. And as that chronic pain practice has evolved over the years, we've had to come to understand peripheral neuropathy very acutely, because the model out there that is currently out there indicates that peripheral neuropathy is caused by diabetes half the time. They might throw in a little bit of you could have a potential spinal cord problem in your neck or your low back, or you could have a tarsal tunnel problem, which is a pinched nerve in your ankle. And other than that, it's cryptogenic. It's idiopathic, meaning nobody knows what it is, except the studies out there in the medical field and put out by and I got to remember this eventually, the National Board.
It's the American Academy of Neurology.
American Academy of Neurology puts out a book every year on different neurological issues, puts out a book on peripheral neuropathy that indicates that there is approximately 80 different causes of it. They seem to be correct based on our...
And that's from the Contemporary Neurology series.
From the Contemporary Neurology series. And so we're going to talk about rheumatoid arthritis. As this snippet, rheumatoid arthritis patients can get peripheral neuropathy as other patients can get peripheral neuropathy. Some people come in and they have one thing, and then all of a sudden they have peripheral neuropathy. Frequently they're not connected. We're going to talk about why those of you, and we've had patients with this, we're going to talk about why those of you who have rheumatoid arthritis maybe just seem to have it in your hands, maybe getting other pseudo peripheral neuropathies, and or maybe getting an actual peripheral neuropathy that is secondarily related to your rheumatoid arthritis. And I'm going to defer over to Dr. Gates at this point in time, because he manages these cases. Again, we're putting together a book on it, which Dr. Gates is doing pretty much all of the research and writing. I'm kind of doing the editing of it on peripheral neuropathy, and this will be covered in that. But in the meantime, here's something for those of you who might be interested.
So yes,
rheumatoid arthritis-related peripheral neuropathy.
So in essence, what are termed connective tissue disorders, which include rheumatoid arthritis, which many of you know, if you're watching this, you can have the arthritis affecting your hands, your neck, many joints in your body. That immune inflammation can result in the nerves down in your feet starting to die, basically. And the exact mechanism as to why that occurs is not really expanded upon in the neurological literature, except that they just think that the immune system, when it's out of control, causes those nerves to dysfunction. We have seen cases of rheumatoid arthritis-induced peripheral neuropathy, as well as lupus-induced, Sjogren's-induced. Lupus is another autoimmune condition, as well as Sjogren's. Sjogren's involves a person having dry eyes and a dry mouth, because the salivary and the lacrimal glands get infiltrated by immune cells. But anyways, so...
I think in the end, what we've seen consistently is if a person has one immune problem,
they lots of times have multiple.
They're going to have multiple problems, and then what we seem to understand and see is that if an immune system, when your arthritis is hurting, your immune system is acting up, it's attacking the synovial, the joint linings and the cartilage in there, and then eventually that can cause other damage to other tissues in the body. Would that be
that's a great way to say it.
Simplistic and accurate way of saying that?
Accurate.
And some of those other tissues can be the nerve endings in your feet.
Right.
That's what he said.
And that can result in numbness, tingling, burning pain. We have one patient who had small fiber neuropathy secondary to rheumatoid arthritis.
So it usually develops small fiber.
I won't say usually. It can be across the board, but in our experience, we saw a few small fibers. But in essence, then we go in and we try to calm down the immune system through nutritional therapies. We're not taking people off their RA drugs or anything like that. So we work with the rheumatologist, but we try to augment or change the immune system through dietary interventions aimed at getting rid of bacteria that can be associated with autoimmune diseases. You can go to our Facebook page and see some of the articles we wrote on rheumatoid arthritis relative to that, because those with rheumatoid arthritis are being shown to develop your specific immune reaction because of Prevotella bacteria in the gut, as well as Porphyromonas gingivalis bacteria in the mouth.
So it's a mouthful.
Yeah, exactly.
In the mouth.
And so they're finding bacterial DNA from those species in the joints of rheumatoid arthritis patients. That's where this has all come from. So there's an intense emphasis on the gut. But we look at the gut while in concert trying to stimulate the nerves in a certain manner, largely by using electrical stimulations, which are pretty powerful and far more powerful than the standard TENS unit, and getting the nerves to function better. There's a specific way that that has to be done in our experience. You can't just haphazardly stick some electrodes on the feet and swing for the fences and hope that the person gets better. And in doing so, we've had some pretty neat results. So we wanted to talk about rheumatoid arthritis, neuropathy, because as Dr. Rutherford mentioned, we're writing a book, and we're actually starting a new webpage called Peripheral Neuropathy Group.com, where all these videos can be accessed, because a lot of patients out there are told that their neuropathy is idiopathic, cryptogenic, go home and live with it, take
easily
gabapentin.
80% of the people that I've interviewed have been told that.
Which is fine to take gabapentin if that's helping you, but we're trying to get to the correction of the problem, so to speak.
Mm-hmm.
And rheumatoid arthritis can cause carpal tunnel syndrome, which is technically a peripheral neuropathy, but it's not peripheral neuropathy from the standpoint that we're talking about it.
That's the pseudo that I mentioned, pseudo peripheral neuropathy.
And really, that's where the lexicon gets difficult, because
Okay.
carpal tunnel syndrome, not to correct you,
No.
carpal tunnel syndrome
I
is
can
a
be correct.
peripheral neuropathy, but peripheral neuropathy, the term, actually really more refers to distal symmetric polyneuropathies, which is where there's more than one nerve and more than one extremity involved.
That's why he's doing all the technical aspects. I'm not.
We just try to be specific because this will be out there forever.
Right.
And
Right.
And so anyways, that's our information on peripheral neuropathy as it relates to rheumatoid arthritis. And if you have any more questions, you can go to our Facebook page, ask us there, or you can ask us on powerhealthtalk.com.
Okay. Thanks for your interest. Thanks for watching.
Thanks for watching.